Respiratory protection and self-contained breathing apparatus are used to protect us from harmful gases, fumes, vapors, and chemicals, as well as where the air doesn't contain enough oxygen to support life. You need information and training on this type of equipment and the hazards involved before you attempt to use respiratory protection. Your organization will provide specific training, but this program is designed to give you some information about personal protection under adverse or hazardous conditions. Let's begin by talking about the basics of why the protection is needed. We all know that chemicals and hazardous materials may have an adverse effect upon your health, but the effect may not show up for years later after repeated or long-term exposure. If you drop something on your foot, you know it right away. If you're exposed to a harmful chemical, you may or may not feel the ill effects for a long time, if ever. Some chemicals, such as chlorine, act quickly, so you know about that exposure immediately. Breathing is a natural function, and we usually never think of how it happens. Our brain sends messages to the nerves and muscles in the lungs, telling them to function. The diaphragm, a large muscle stretched across your abdomen, contracts to pull air through the nose, down your windpipe, and into the lungs. Once in the lungs, oxygen migrates into the bloodstream through the thin walls of tiny air sacs deep within the lungs. Breathing toxic chemicals end up in the lungs. Naturally, the lungs, liver, brain, kidneys, and central nervous system are all potential targets of many chemicals. Your body has some natural defenses, such as hair in the nose, tiny hair cells that line the entire respiratory system, and other similar defenses. They cannot defend against many harsh or dangerous chemicals. One of the problems that we all encounter is dust. Dust can be in the forms of nuisance or hazardous dust. They float in the air and can enter your body through breathing, skin absorption, or through eating or drinking the residue created by the dust. Fumes occur during high heat operations such as welding or smelting. Mists are hazards found in operations such as painting or pesticide applications, or any area where liquids are set in motion in the air. Gases are usually produced by some chemical process, such as hydrogen sulfide found in sewers or storm drains. Carbon monoxide gas is usually a byproduct of engine exhaust. Some of these gases have odors, some do not. Hydrogen sulfide smells like rotten eggs. Carbon monoxide is odorless and has no color. Vapors are the products of volatile liquids giving off vapors such as gasoline, paint, or solvents. There's still another hazard, oxygen deficiency. Oxygen deficiency is simply a lack of oxygen in the area you are working, such as confined spaces. Protection from respiratory hazards requires the joint cooperation from both you and your employer. The employer has the responsibility to determine the hazards of the job and to reduce or eliminate the hazard as much as possible. The employer also provides the respiratory protection program. You have the responsibility to follow your company policies and procedures. The first step in a respiratory protection program is to have an examination by a physician to determine your fitness to wear respiratory protection. Also, if you have a beard or facial hair, you cannot safely wear respiratory protection, as the hair on your face will not allow for a proper fit of the equipment. Training is a very important part of the program. You need to know how to fit, inspect, clean, store, and how to tell when respiratory cartridges need replacing. Proper training can mean the difference between proper protection and the alternative. Okay, let's take a look at some of the types of protection that are available. Disposable masks, similar to this one, are designed to protect against dusts. Disposable masks can also be approved for some hazardous dusts, fumes, and mists. They do not provide protection from vapors, gases, oxygen deficiency, temperature extremes, or even high levels of contaminants. The most common mistake made by employees is to use a dust mask as protection from spray painting. A dust mask cannot prevent harmful vapors from entering your breathing zone. It just gives a false sense of security. You must determine the hazard, then select the appropriate protection for that specific hazard. When fitting a disposable respirator, be sure you have a snug fit. If a metal nose clip is provided, mold it to ensure a snug fit. If adjustable straps are provided, adjust them for a good fit. When any respirator becomes clogged with trapped particles, it becomes more difficult to breathe or possibly allows odors to enter the breathing zone. When this occurs, it is time to change the respirator or cartridge. Half-mask respirators are designed to cover your nose, mouth, and chin. They also have replaceable cartridges that filter or trap dusts, mists, and vapors before entering the breathing zone. Each cartridge has a specific purpose for a specific chemical, and some cartridges may protect against several types of hazards. They may even have a pre-filter that traps additional dusts, mists, and fumes.